Okay, we know we got sound now. Yay! All right. Thank you very much. All right. Let me get the PowerPoint.
All right, you good?
Yes, I'm good. Yes. Hi, everybody. My name is Christina Hazenkamp. I'm the employee health nurse at Community Healthcare System. And today I'm going to be talking to you about PAPR education. At CHCS, we use the VersaFlow TR600 PAPRs. I have a PAPR out here in front of me, but first we're going to go through a little bit of a PowerPoint and kind of talk about the different features of this system. So the VersaFlow PAPR, there's actually two versions. There's a TR300 and the TR600. I'm just going to be going over the ones that we have in our system. So for our first lesson, we're going to talk about the PAPR basics, inspection and parts of the PAPR, and performing daily checks. And before I go any further, just want to mention that the purpose of this video is to give at least a background. If you've not worked with this equipment before, or if it's been over a year since you last worked with this equipment, you will need to either get with me or with another PAPR instructor in our system and go over the hands-on portion of this. We just wanted to do a video to help us catch some of our PRN staff, or also to catch any of our staff that may be students and are doing their actual job while they're here and may not have time to attend a class. So hopefully this will be helpful and give you guys an idea of the system and how it works. So, all right, so the first lesson is the PAPR basics. The nice thing about the VersaFlow PAPR is that anyone can wear it. You will have to pass your OSHA mandatory questionnaire. But once I get that form back, and when you pass it, then you are clear to wear the respirator. OSHA requires that we do this training every year, and that the OSHA questionnaire is updated every year. So I send those out typically in the summer to try to catch our PRN staff, since a lot of our PRN staff are here over the summer. Some of the benefits of this system: it's cleanable and it's reusable. This system is more effective at filtering out particles out of the air compared to an N95. Another big benefit of the system is you don't have to be fit tested to wear this system. And some of our male colleagues, if they have facial hair, they can still wear this system as long as the hair can be tucked into the hood and doesn't interfere with the seal of the hood. Okay, so how does the system work? So the PAPR works by pulling the air through a HEPA filter. The HEPA filter takes out the particles, 99.9% of the particles that are in the air. So the air that comes through the motor and into the hood is clean. So the air coming into the hood is being forced in by the motor, and it creates a positive pressure. So the air is being forced out of the hood. So the air on the outside can't get into the hood. And that's how this system protects the person that's wearing it, okay? Because it creates a positive pressure. Okay. So in this, when would you need to wear this system? So a PAPR is considered a respirator. So a respirator is a higher level of mask than, say, a surgical or a procedure mask. These masks are designed to give the wearer more protection. So we would want to wear a PAPR, or if you've been fit tested to an N95, You would want to wear those if you were working with a patient that had tuberculosis, measles, Ebola, COVID-19, or chickenpox. Or if I left anything out, anything that's considered an airborne transmission, you would want to wear this system for, okay? When in doubt, if you have a patient that is getting a respiratory panel drawn, it doesn't hurt to wear your N95 or this system just to protect yourself so you don't get sick. Okay, so one of the questions I get a lot is, do I need to wear a mask with my PAPR? So like I said, when you are wearing this system, you are going to create a positive pressure that forces air out of the hood. Because we now have illnesses like COVID-19 that you could be contagious, but you may not have any symptoms. You could actually be wearing this system and spreading COVID and not even knowing it. And it's not just COVID. There are other illnesses that are highly contagious, like measles, chickenpox, influenza, that have a 24, 48-hour window where you are contagious but not symptomatic. So in order to prevent from spreading these illnesses, we want people to wear a KN95 mask or a surgical mask underneath the hood when they are wearing the system. Again, it's just meant to protect, and because we don't want to contaminate the environment that we're working in. Okay, any areas where you cannot wear this system? Yes, surgery is one. We try not to wear these in surgery because, again, like I said, when you wear this, you can contaminate a sterile field. However, we have had some cases, some instances where a provider cannot pass a fit test on an N95 and they have to wear a PAPR. Again, they would wear a KN95 or a surgical mask under the PAPR hood to limit the contamination. The other place you cannot wear the system is in the MRI. Again, that's because the system has metal components. There are other places where you cannot wear this. A good example would be if there was a fire. You're not going to put this system on to fight a fire because it filters air. It does not create air. There's no oxygen supply hooked up to this system. So if you are fighting a fire and going into a smoke-filled room, that smoke has already eaten up all the oxygen and you are going to pass out because there's going to be no oxygen. So you cannot use this in an area with less than a 19% concentration of oxygen. Also, do not use this if the environment is immediately dangerous to your life or to your health. Again, fighting a fire, walking into a big chemical spill. You just don't want to do any of that in this system. Okay. So that's kind of the basics of the PAPR. So what we're going to look at now are the individual parts of the PAPR. And I guess I should also clarify, PAPR is Powered Air Purifying Respirator. So that's what PAPR stands for. So the first part of the PAPR is the hood. When you look at the hood, you need to look for any rips, tears, or anything that would compromise the hood, okay? This is a new hood. There is in here a little deal, I call it like a baseball cap adjustment. You can adjust the hood so it can fit your head like a baseball cap would. And it's just by loosening or by tightening it up. The goal of that is so this little gray bar, which I don't know if you can see in the video, but there's a gray bar at the top of the hood. You want that to hit right above your eyebrows. So this is also a PAPR hood. This one has a shroud. So we would use a shroud if we had a patient that had like Ebola. This would cover our neck. I think in the cases when they had the Ebola patient in Texas and they had nurses come down with Ebola, it was because small areas of their neck was exposed. So that's why we would probably use something like this in those cases. So, okay, so that's the hood. So the next piece of the PAPR we're going to talk about is the motor blower unit. The motor blower unit, needs to look intact. Any cracks, any damages to this part of the system can really impact the quality of air that you get, because we only want the air coming in through one way. But if there's holes or if there's cracks in this, then air is getting in and may not be going through a HEPA filter before it gets to you. So a couple of things you want to look at. You're going to look at the air inlet, which is also contains the motor. Just a couple of things to note. You don't want to let any fluid get inside the air inlet. You don't want to use a vacuum or compressed air to clean this system, because there are very delicate parts on the inside that can become dislodged. So no water, no compressed air, no vacuum. And the same thing goes for the air outlet. No water, no vacuum, no compressed air. Okay. So again, you're looking at the system. There should be 4 belt attachments on the back. On the very bottom, there should be 4 gold prongs that are sticking upright. If any of those prongs get bent over, the system will not work. So that is the motor unit. Okay. The next piece is the filter. So the filter is disposable. What we want to do is determine how long a filter is good for. The manufacturer will say they don't want to give a statement saying the filter is good for 6 hours of use, 12 hours of use. They don't do that. And part of the reason is they don't know what you're going to use the filter for. If we are using the filter for people with measles or people with tuberculosis, it might have a different impact on it. Or if we're using it for someone with Ebola, or if we're using it in a decon shower, again, different impacts will affect how long this filter will be good for. So taking that into consideration, what we determined was on the motor unit, it will tell you the filter life. So that's what we go from. When we get down to the last bar of filter life, that's when these filters need to get changed. Or if it's becoming difficult to get air through the system, it's time to change the filter. Or if you're looking at the system, you have it taken apart, and you pick this up and you shake it, you can hear fluid sloshing. And don't shake it too hard, because we don't want to dislodge a whole bunch of bacteria from it. Or if it looks really nasty, dirty, like it's been used quite a bit, go ahead and throw it away and order a new one. I would encourage the locations that have these to have extra filters ordered. They can order them through Central Supply. Okay. The next piece is the filter cover. And this is a very important piece. This piece protects the filter. You can see on the very front, there's all these little holes, and that's where the particles go through and get filtered. What this system does, what the filter cover does, it prevents water. Like if you're going to use this in a decon shower, this is what's going to prevent the water from getting into the filter and clogging the filter while you're in a decon shower. So it's very important that this piece stays intact. And that's what I'm most worried about, because this is a very flimsy piece of plastic that they made the cover out of. So please be very careful when handling that. Okay, the battery. This is a lithium-ion battery. It is rechargeable. It has a button on the bottom of the battery that you can test how much battery life you have. Again, you want to do an inspection of it, make sure that there's no cracks, holes, or other damage, and that the plastic is intact. You want to make sure that the part that connects to the PAPR is free of corrosion. And when you attach this to the motor, you kind of want to tug a little bit on, just very gently, just to make sure that you've actually got it attached. So just a couple of other points about this battery. It has a 7 to 12 hour runtime. The runtime depends on the fan speed. So the nice thing about this PAPR, it will give you extra air, especially if you're somebody that may get claustrophobic. You can increase the fan speed to get more air in the hood. But if you do that, your battery life will go from 12 hours to 7 hours. Batteries, they need to be recharged after each use and at least every 9 to 12 months. So what I've encouraged all the places that have these PAPRs is to set up a monthly inspection for your PAPR. And we'll go over a few more details on that later. But one of those things that they're supposed to do on their monthly inspection is charge all the batteries at least once a month. So. Okay, so the next part is the belt. So this is the belt. It's you just want to make sure that you adjust it for your size. Again, the bumpy side is what's going to come against your back. Okay, and that makes sense because that's how the belt is facing. So just make sure that you have the right side going the right way. You will see on here backpack. So we do have some backpacks throughout the system. They were put into place because we had some younger helpers that we couldn't get the belt small enough and the PAPR was falling off of them. So the backpacks are designed to be used in those cases. And basically when you're using the backpack, instead of the PAPR sitting like this on your back, it'll sit like this. So the battery charger, not too much to say about the battery charger. If you're not directly involved in charging it, you don't have to worry about it. Again, the only thing I will say about it is it does have the same 4 gold prongs, and those, just be very careful if you ever do clean this system that you don't bend any of those over. If you do, then we won't be able to use it to charge batteries. Okay, the breathing hose. So when you're looking at the breathing tube, you want to make sure that it's nice and flexible, pliable. There's no holes, rips, or tears. So the end that goes to the motor, has 2 silver prongs. You want to make sure that those are intact. The end that goes to the hood has a little squeezable deal, and that's how you release it from the hood. Oops, sorry. See if I can go back. Check before use. So before we use this system, there are 2 daily checks that we have to do. So let me get my system put together here. So what I always do is there's a little lip on the battery that goes in first. And then sometimes you got to push the button. Battery will click together. Okay. The next part, I'm going to put the filter on. So the first thing you want to do, make sure the cover is on the filter, and just very easily, you just want to lift up and take apart. And then when you're putting it back together, you just line those back up. You might lift up on it. And it didn't click. Usually it clicks, so I'm going to try that again. There we go. So then the filter cover is in place. So when you're going to put the filter into the machine, there's a little diagram on the motor. And it says this end needs to go down first. So you put that end down first, and then you push the other end until you hear the click. Okay? All right, so we've got our system put together. So now we're going to turn it on. The power button is a smaller button, so you press and hold. Okay, so it's just going through its warm up. Okay, so what the system did went through its warm up. It gives me the filter life indicator, the battery life indicator, and my air fan speed. And right now I'm on the lowest setting. But if I want more air, I press and hold, get a little bit more air. And now I'm at the max. Okay, I'm going to reset it. Okay, so now our unit is running. All right, oops. Uh-oh. Oh, I hit the wrong button, sorry. All right, so the first check we're going to do is the airflow check. So the airflow check is done once a day while the PAPR's in use. So if you're the second person to use the PAPR that day, you don't have to redo this check. You'll need to take the airflow tester and insert it into the air outlet. Okay. To determine if the PAPR is working is based on your elevation and the temperature. So based on that, a rough guess of where we should be at is the letter F on your airflow meter. As you can see, I don't know if you can tell, but the orange ball is clear at the top. So we have really good air output from the machine. So typically what you want to do is you let this run for a minute. And that way you can get through the check. So we're going to say, you know what? It's been a minute and it ran and it did good. The ball stayed up. So it passed the first test. So then we're going to take this piece out. We're done with it. The next test we're going to do is called the low flow alert test. And this test is meant to simulate if something was going wrong with your PAPR. Let's say either the battery was dying or your filter is getting full. Okay. So this is what you would hear and what you would experience if either one of those things were happening. And if you hear these things or experience these things, you need to get out of that room and get to a place where you can take the system off and examine it. So to do the low flow alert test, you take the palm of your hand and you cover the air outlet. And it's going to try to clear the obstruction. You wait for three things to happen. You wait for a visual alarm, an audible alarm, and the unit will vibrate. Okay. Right now I'm getting the audio and the visual. And there's a vibration. So I'm going to take my hand off. It just takes a little bit. It's going to reset itself. Okay. So now the PAPR has passed the 2 daily checks. So this PAPR is good to go for the day. Okay. So now that you've done both of your checks, the PAPR is ready to be used for that day. Okay. I have a short video of donning and doffing that comes from 3M. There is no sound. And just note that the system that they are using is not the TR600. The system that they are using is the TR300. So there's going to be some differences. Typically, and I believe this is what Karen donning and doffing instructions say, is that the PAPR should go on over the gown. And the reason for that is the air. You don't want the gown to cover up the air inlet. So underneath the 3M VersaFlow logo is where the air is getting pulled into the system. So if you're wearing a gown that will cover that, it may interrupt your air supply. So the PAPR units are cleanable, so they really should be going on over the gown. But in this case, the gown kind of has an open back, so I don't think it's a problem. And he's kind of demonstrating the PAPR hood of the shroud, so you can see how it's protecting his neck. If you don't have someone that can help and take the PAPR from you, always back up to a table and make sure that the PAPR just lands kind of gently onto that table. The last thing we want is for the system to hit the floor. Okay. All right, so the next lesson is cleaning and paperwork and training. So basically for the PAPR cleaning, should be cleaned regularly. Wipe down cleaning is sufficient. I put on here a whole bunch of stuff that you're not supposed to do. Remember, no compressed air, no vacuum, and don't allow liquid to enter either the air in or the air outlet. Don't use cleaners that can leave a residue. When you are cleaning it, make sure everything is thoroughly dried before you put it into storage. So the wipe down cleaning, for people that have to reuse, especially the hood, I recommend the Sani cloths. You can also use cavi wipes, but the cavi wipes leave a very harsh odor. So the Sani cloths don't as much. So I would recommend using the Sani cloths when you're wiping down the PAPR hoods. PAPR hoods, again, they can be wiped down, they can be reused until they become grossly contaminated. Or if they have any defects, then you want to get rid of them and change, you get a new one. And you can get a new one. You just need to tell your manager you need a new PAPR hood, and they can order it through Central Supply. Okay. So storing the unit, these units need to be stored in an area where they are protected from hazards in the environment. They also need to be stored at room temperature. If it goes into prolonged storage and it's not getting used on a daily or a weekly basis, then OSHA requires that we take them out and we run them. And we need to run the motor for at least 5 minutes and inspect the unit. The reason for that is when you run the motor, it lubricates the parts of the motor so it keeps working. And whenever you put a PAPR into storage, remove the battery pack from it. Don't leave the battery pack on the motor and do not leave it on the charging station. And that's just a 3M recommendation. Okay, so putting on the PAPR, inspect the unit. Again, make sure you have this on a table behind you and reach and grab a belt and fasten it around your waist. In order to show you all those parts, I'm just going to go ahead and finish putting this together. So what I'm going to do is I'm going to put the PAPR like this so the air outlet is facing away from me. I'm going to grab the belt. And again, the edge with all the bumps on it is the edge that faces you. So you push this edge on. You're going to hear a lot of bumps, or sorry, a lot of pops as you push this down. And then after you push it down over the 4 prongs, you're going to slide it up. So that way it locks into place. So the next thing you're going to do is attach the hose. So you're going to line up the silver prongs so they go into the machine, and then you're going to push down and twist. I'm going to say clockwise twist. And then after you do that, the hose should be securely attached to the motor. Okay, so the next piece we're going to add is our hood. So again, the hood just snaps together. Okay, and then you can put your hand in here and you can feel the air coming through the system into the hood. Okay. Then what you're going to want to do is just do the adjustments for the belt. So that way, when you get ready to put it on, and these belts can be very difficult sometimes to work with. Sometimes it takes a little bit. So just make sure that you give yourself time. So that way you can get these belts adjusted appropriately. And it also doesn't help they're like new belts, so they don't want to, they really don't want to cooperate. So. And that's why it's really important that when you guys are looking at this system to do more than, to make sure you do have some hands-on time with this system. Because seeing it on a video it's very different from doing it in person. So please make sure you contact me, and we can get it set up so you can get a hands-on. Okay, we're gonna try that. All right, so we've got the belt on, we've got the hood on, we're ready to put this guy on. Oh, this is the doffing. So, okay. So you're gonna set it up, and you're gonna turn around, put your back to it, lift the system up, and then you can attach the belt. And then you're gonna go ahead and put on the hood. This hood, I could actually see better if I would take off this film, but the film is protecting the hood from getting scratches on it, so I'm gonna leave that on. But this is what it looks like when you're wearing it. So let's say now I've worked with the patient, I've gotten everything done, I've given them their medicine, done everything I'm supposed to do. I'm getting ready to leave the room. So I'm gonna go over to the door, to the exit. I'm gonna go ahead and do my hand hygiene and go ahead and exit the room. When I'm ready to take off the hood, what I want to do is with my clean hands, kind of get in underneath here without touching the outside and lift up. That way I don't contaminate my hand. And then again, what I would recommend is outside of the room, having a little table. If you don't have a person there to help you, put a chucks down, and then that's where the dirty stuff is going to go. So you're going to set this down. And then that person, if the same person is taking care of that patient for the day, and they're going to reuse the system, they can just do a very light wipe down clean. My only concern, because I was asked that question. I was asked the question of, do I need to do a deep clean each time if I'm going to put it back on in 15 minutes? And the reason why I'm hesitant to say no is because I don't want you to get contaminated because you didn't clean it very well in between uses. The answer is you should always clean it really well between uses. But if it's somebody that's high risk for falling, or you're going to be in and out of that room a lot and you can't pass on an N95, I would say I would focus on cleaning the hood and cleaning like the part where you're going to be touching. So the belt and the on and off switch. So otherwise, if you're done and you can clean it and let it air dry, that is the best thing that you can do. Okay. So again, this is where you could do your donning and doffing. Okay. Troubleshooting. If you run into problems with your PAPR, there are some different things that we can try. The easiest things that we can do, turning the system off, turning it back on. Sometimes that will resolve it. The only other two things that I know of how to fix this is if the filter is getting full, change the filter. If that doesn't fix it, maybe the battery is dying and you need to get a new battery. Okay. Otherwise, everything else, we would need to set it off. So, okay. So that is the VersaFlow TR600 PAPR. I want to thank you guys. And if you have any questions, feel free to contact me. You can email me or call me, and I will be happy to answer your questions. All right, let's stop share. Oh, one thing before I go, I just want to let you know that I need 2 forms from you. I need the PAPR competency checklist and your PAPR Pop Quiz 2023. You turn those into me and then I check you off. And basically, if you're coming to me to do a hands-on, we can do that then. We can get that paperwork done then. But if you are going to somebody else, make sure that they get that paperwork done so that way you can get checked off for the year. And we'll see you again next year.